From the makers of vet-recommended Greenies dental treats comes an easy way to support your dog's wellness. Greenies Smart Essentials Dry Food delivers complete balanced nutrition with science-backed recipes. Greenies Supplements, developed by a team of PhD animal nutritionists, offers options to help support healthy joints, digestion, and more. Whether it's mealtime or mobility support, Greenies helps you care for your dog from the inside out. Learn more at greenies.com.
You're listening to Veterinary Vertex, a podcast of the AVMA journals. In this episode, we chat about how phenylbutazone treatment of mares does not reduce embryo production via intracytoplasmic sperm injection with our guest, Kristen Loncar.
Welcome, listeners. I'm Editor-in-Chief Lisa Fortier, and I'm joined by Associate Editor Sarah Wright. Today, we have Kristen joining us. Kristen, thank you so much for taking time out of this crazy therogenology time frame in your life to be with us here today.
Thanks for having me. I'm really excited about this. All right, let's trot on over. So, Kristen, your JAVMA article discusses how mares that are undergoing transvaginal follicle aspiration and intracytoplasmic sperm injection can remain on phenylbutazone for comfort and quality of life. Please share with our listeners the background on this article.
Yeah, so the whole process of transvaginal aspiration and ICSI has really evolved over the last 20 plus years. Initially, it was kind of one of those last-ditch efforts for those mares that are older and had a lot of chronic uterine problems where they couldn't be bred or have embryos fleshed anymore. And now there's been so many advances, and it's actually become a really efficient way of making embryos. So we do see a lot more young, healthy mares that can come in. So that way, if they're busy training or showing, they can just come in, get aspirated, and potentially make multiple embryos from one session. With that being said, we still have a very large population of mares that are older. A lot of them have chronic osteoarthritis issues. I see a lot of laminitic mares that come in, anything like that, where they really need to be on some sort of nonsteroidal plus or minus other medications to be comfortable, be able to ambulate, and just have a relatively decent quality of life. And so last year, a paper came out that described that mares having 10 days of bute or phenylbutazone had a 0% blast rate after ICSI. And so at the clinic that I work at, we read this paper and we kind of went, that doesn't really fit with the clinical picture that we see. We started going down the list and naming all of the mares that we could think of off the top of our head of, okay, this one's been on bute and this one's been on bute. And so this project really started just kind of for our own information. We wanted to know, were our expectations unrealistic? Were we making assumptions that were incorrect? Is it really that detrimental? And part of it was we wanted to know, since we had some embryos being produced, okay, maybe there was a decrease that we should be expecting, and we should kind of figure out what that decrease was so that when we're talking with clients, we can come up with kind of all the facts and have better expectations. So it started off as just an in-house kind of wanting to know situation, and it definitely morphed into multiple rounds, multiple types of phenylbutazone. And the great thing was that the mares that we were using in our study, we saw no differences. And in fact, some of the mares that were on phenylbutazone had higher blast rates than the control mares. So at least we kind of got the information we were looking for, and have some information that we decided we wanted to share with other veterinarians and other clients so that mares would continue to remain on nonsteroidals if they needed them, and people wouldn't be scared off of it.
I feel like we hear that so commonly on this podcast, like, hey, we noticed this one thing but thought differently. So we wanted to actually investigate and see if there's evidence to prove this. So definitely a cool myth buster, I think, for this episode, which we appreciate. And what are some of the important take-home messages from this article?
The biggest take home is the fact that it does seem to be safe to leave these mares on phenylbutazone. We didn't see any decrease in blastocyst rate. We tested the liquid preparation given orally, which is fairly common in my area. We tested the liquid given IV, and we tested one of the paste phenylbutazones. So there's a number of options that we can still use, and these mares still produced high numbers of blastocysts. So if you have a mare that needs to be on it, she certainly doesn't need to come off just because you're trying to make some embryos.
Yeah, such great clinical, really important clinical information. So thank you for sharing that. What sparked? We have so many great options in veterinary medicine, so many fabulous careers. What sparked your interest in theratogenology?
That started all the way back in college. I had an amazing professor that taught reproductive physiology, and we had a breeding program at the university. And so once you took his class, you could then participate in breeding and foaling out the university horses. And so I just kind of became fascinated at that point. I was then given an opportunity to work at a really well-known large Arabian breeding farm during college. And then after that, during vet school, had a number of mentors that kind of showed me, you can actually make a career out of this, which was amazing. And things just kind of kept falling into place. So I ended up doing exactly what I was hoping I could do and didn't think I could.
A little bit earlier, Sarah asked you, and you nicely articulated what are some of the important take homes. Mares can stay on phenylbutazone for their comfort and no decrease in embryos. But every time we do a study, there's something that surprises us. What do you think surprised your team about this study?
I think mostly I was surprised at how little effect there was. Going into it, we thought that there was probably going to be some decrease. Um, there hasn't been a whole lot of work looking at what different types of medications or supplements or anything like that do to the oocyte. And so we know when we give some sort of nonsteroidal, when we're trying to breed a mare, we're going to run into some problems. We're going to have potentially increased episodes of hemorrhagic follicles, follicles that fail to ovulate. We'll have increased fluid after ovulating. But we really didn't have any idea what happens to the actual oocyte itself. And so we assumed we'd have some sort of a decrease. We just didn't know what that decrease would be. And the fact that there was no decrease at all was really surprising.
Yeah, super valuable information. Thank you again for sharing it with our journals. So, what are the next steps for research in this topic?
I think there's a couple things that need to be done after this. Although not statistically different, we did see a lower percentage of blasts produced with the paste formulation. So I don't know if that was just a coincidence or what. We tried to use the same paste that was used in the previous study where they had 0 blasts produced, but it wasn't available. So maybe there's something in the paste, some sort of carrier that can actually cause problems. So it would be really interesting to try a number of different brands of the bute paste to see if that is potentially going to be an issue. And then after that, I mean, we use a number of different nonsteroidals in veterinary medicine, and it would be interesting to see if any of them have effects, since we just did phenylbutazone.
Always more questions than answers sometimes. So, hopefully, we'll see some more work from you, Kristen. And do you see a role for AI in this area of research?
I'm not really sure about the exact type of studies that we're doing, just because there's so much physical work. It would be really nice to have a way to design the experiments. We wanted to make sure that we had enough numbers that our significance could be accurate and trusted. So it would be nice to have the studies designed that way. And then obviously the data analysis is always kind of the hardest part. So that's always nice. I know, not really related to this study, but I know there's AI being developed to analyze the blastocysts as they're developing, looking at cellular changes and that sort of thing to kind of help predict the outcome of each of these embryos. Because right now, we kind of grade them based on how well they develop, what they look like at cleavage, how fast they develop. But I know there's AI being developed to really analyze, okay, this one has this chance versus this other one that doesn't have as good of a chance, just based on what it looked like at each little teeny tiny change in the process.
Very cool. And for those of you just joining us, we're discussing how phenylbutazone treatment of mares does not reduce embryo production via intracytoplasmic sperm injection with our guest, Kristen.
Kristen, you talked about your wonderful exposure in undergraduate and then throughout veterinary school. So you have a lot of experience in this field, but so how did all that combined training help prepare you to write this article and even really execute the study?
So I think I have the training to do the procedures that I've developed at the practice that I'm currently at, and then the training to kind of design an appropriate study for my residency. So I've spent a lot of time aspirating mares, getting more efficient at that, doing the actual ICSI process in the lab. And that's all just been learning on the job. But the residency really prepared me to look at data critically, design studies that have appropriate controls. We did crossovers to try to make everything as even as possible. We tried to make it as blind as possible so there wasn't any sort of bias during the aspiration process or during the injection process. So there's been a lot of steps along the way where you learn different techniques and pick up different methods of doing things. And then as well, the scientific part is just a whole nother ballgame of difficulty. And luckily, I have a lot of people in my life that were good sounding boards, and we could bounce ideas off each other and verify that we were doing things kind of as thoroughly as we could.
That's great. Sounds like you had a really good team, so that's awesome to hear. Now, Chris, this next set of questions is going to be very important for our listeners. And the first one's going to be dealing with the veterinarian's perspective. What is one piece of information the veterinarian should know about phenylbutazone treatment and embryo production in mares?
The biggest thing as the managing vet is to continue to treat the horse. If you have a mare that needs to be on phenylbutazone, make sure she stays on it and maintains quality of life. If I had the choice, I would probably stick with either the IV formulation given IV or given orally versus the paste. I just feel like we don't know quite enough about the paste yet. But since we didn't see a statistically significant difference, if that's your only option, I would absolutely not stop it just for the sake of aspirating and creating embryos.
And from the client's perspective, what's one thing clients should know?
I think the clients need to be comfortable with the veterinarian's decision to keep the mare on bute as well. We all know how fast information can travel. And so I think that was one of the reasons this study went from let's just see for our own knowledge to we need to make sure we do a thorough job and try to get this published. Because we were concerned with the previous article coming out that the mares that were on phenylbutazone produced 0 embryos, that clients would just latch on to that, one fact of not being able to give my mare bute anymore, and that's that. And we absolutely don't want mares to be uncomfortable. We don't want them to suffer. We don't want any of that. So we want to make sure that clients understand that from a scientific point of view, from a researched point of view, they can absolutely keep their mare on phenylbutazone, and you're not going to have an effect on the way she produces embryos.
Yeah, you just have to keep reminding them there's a difference with embryos and other sorts of repro and lots of I mean, it's not uncommon too in my field of regenerative medicine. Oh, they have to come off it before you make PRP, and that's just not true. Platelet-rich plasma. So yeah, we don't want them to go backwards in lameness or discomfort for sure. As we close, Kristen, we like to ask a little bit of a fun fact, and if you have it with you, you can show us because this is all video recorded. What's the oldest I'm a little afraid to ask a thyrogenologist this question. Like at all vet schools for listeners, like when you go by both the dental and the thyrogenology, the old equipment, you're like, that's terrifying. Uh, but Kristen, what's the oldest or most interesting item on your desk or in your desk drawer?
Oh, wow. I don't have it on me actually, which is sad. I have the fetal heartbeat Doppler monitor that my dad bought when my mom was pregnant with me, which I think is super cool. I can't get it to work, but I think it's pretty cool just to have because, it's a little bit of family history.
Very cool. And in your field.
Yeah.
Yeah, love that. Very cool, Kristen. Well, thank you so much for being here, Kristen, and sharing the manuscript with us as well, and letting our listeners know what they can expect when they read your article.
Absolutely. This has been great. Thank you so much.
And to our listeners, you can read Kristen's article in JABMA. I'm Sarah Wright with Lisa 48. Be on the lookout for next week's episode, and don't forget to leave us a rating and review on Apple Podcasts or whatever platform you listen to.